Well, hello everyone. This is John Byrne with Poets and Quants. We have a special event for you today. We're doing a roundtable on the MS in healthcare management. This is a specialized master's for people who are really interested in pursuing leadership roles in the healthcare industry. And we have two different schools with two very different and great programs. We have in the house Michael Darden, who is the program director, academic program director, and associate professor at the Carey School of Business at Johns Hopkins University, who'll be speaking about both their full-time in-person MS Healthcare Management program and their part-time 100% online program. And we have Mark Meyer, the Stillman Professor of Entrepreneurship, who is a university professor and co-leader of the MS Healthcare Management program at Northeastern University's DeMoore McKim Business School. Welcome, guys.
Yeah, thanks so much.
So, this has become a very popular degree because in healthcare, clearly it's a massive part of our economy. And I think that there has been, in the last 10 years in particular, a greater appreciation for the management and leadership skills required to lead healthcare in the next generation. So I wonder if both of you can give us a brief overview of your approach on your healthcare management program. Who's it best suited for? What's the application criteria, and what are the skill sets best suited for the program? Michael, let's start with you in the Carey School.
Sure. Yeah. Thanks so much for the opportunity to chat about what we're up to at Johns Hopkins. At the Carey Business School, we are committed to pursuing the business of health, and we have a number of degree programs that serve that goal. And the MS in healthcare management is one of the key pieces. So. The program, we have a full-time program, as you said, and a part-time program. They are designed to bring students up to the frontier of understanding on matters of healthcare and health quickly. So our full-time program is targeted at recent college graduates or those with maybe 1 to 5 years of experience. Our part-time program draws in people who have a little bit more experience, some of whom are trying to pivot towards healthcare. Others are clinicians or nurses or practitioners who want to pivot towards the more management side of their fields. And so the goal is to quickly bring them up to the frontier and to expose them to the Johns Hopkins ecosystem and let them pursue their interests within that ecosystem. So the skill sets that are best suited for the program, I mean, we have people who come from all backgrounds. The thing we're looking for is just passion for the industry, for the field. And so we do develop quantitative skills, we develop management skills, but in terms of prerequisites, the most important thing is just passion. So
Right. And I should point out what's really obvious, which is Johns Hopkins, of course, is leveraging its top-ranked med school, nursing school, and School of Public Health in allowing the business school to place itself in a strategy where it's focused on the business of health. And as Michael said, this is one of several degrees being offered in the field by the Carey School of Business. Mark Meyer, you have an interesting situation because your program is really a partnership with the Mayo Clinic. So tell us about it.
Well, it's really different than what Michael described. It doesn't mean it's better. It's just really different. As these often go, it emerges from the interests of the designers. So I was one of the designers. I'm a serial software entrepreneur before becoming a professor, and am doing a medical device company right now. So I'm very much action oriented. When you actually sign on in a hospital into a piece of software, the security mechanism for that, the single sign-on, is something that some friends and I developed and created a company and sold to Microsoft, and now it's part of Imprivata. So I have a lot of experience in things like that in healthcare. We decided in designing this program that we would focus on innovation first, both clinically and administratively. So, for example, clinical AI uh, built into like an ECG machine to detect certain types of arrhythmias, which Mayo has found later on is a predictor, actual predictor of cognitive impairment or Alzheimer's later in life. It's remarkable stuff. That's clinical AI. Or digital pathology to pick up stuff that the eye can't see, or to screen slides and only show those in question to human pathologists, that sort of thing. And then there's a lot of administrative sort of AI that's out there, what they call agentic AI, that comes in for other types of students in the program. So we're really focused on innovation first, like design thinking for healthcare, both in the hospital and down the continuum, like what's happening in the home now with all the devices out there and integrated through a cloud is it's absolutely wild. It's transformative. So that's what we focus on. And then we do the business case for innovation, the reimbursement, ouch, the financial side of healthcare. Also, we do all those things in specific courses, but the real focus is not on young people out of college. It's not better, it's just different. Our typical person has worked for over 10 to 15 years. I had a student who was 60 years old last semester. A lot of people in their 50s, a lot of people in their 40s, a lot of people in their mid 30s, that sort of thing. And they come to the program, uh, I'd like to say to learn, but it's really to learn and to accelerate their careers. And then we have a lot of projects in the courses. At least half the courses are individual project based, where the professors are mentors and coaches with their methodology as much as traditional faculty. And all of us have real world work experience. And the students use the courses to get sponsors in their healthcare enterprises. And yeah, they want to get that sponsorship and then, yes, and then a promotion and move up the ladder inside their enterprises and have a greater purview of responsibility and do new things. I mean, there's many examples, and I know we have more time to get into it, but just as an example, I had a woman who was responsible for clinical trial recruitment at the Mayo Clinic, and they've been going through all the records by hand. So she developed some agentic AI with some programmers that goes through the Epic Health record, which is dumped into the relational database called Clarity, and comes up with an automatic process for selecting specific types of patients with specific criteria to actually fulfill clinical trials. And it's really expensive right now to find the right patients. Uh,
Mm.
and this automates and uses hospitals' data to make that much more effective. So older people, older students, not old, but more mature students, already on the career path, want to accelerate on it, learn innovation, that's the focus, back it up with business case and business finance, and use that to position themselves in their organizations to accelerate. That's what our program is about.
And your program is 100% online, I should point out, which means that
Yes,
you can keep your job and take it at the same time.
it
Johns
is.
Hopkins has that option as well, as well as the full-time 1 year option. So, Michael, tell us a bit about the curriculum, the courses a student might be expected to take, and what level of experiential learning occurs in your program.
Sure, yeah. So, it is a busy space. All the masters in health something across, and we've heard two different examples of them. Our program is really focused on the business training that is so important in in this industry. So I think that really differentiates us from an MHA, for example. We are, I think it would be fair to say that we are broader than what Mark described. We train in not just healthcare, but a variety of health producing industries. So pharmaceuticals, the devices and diagnostics, insurance, payers. We talk about that quite a bit. So the goal of the program is to bring students up to the frontier so that they understand how the industry works across these different organizations. Our curriculum then emphasizes traditional business training. So we have courses in finance and marketing and operations management, in economics. But importantly, these are all applied to healthcare settings. And so
Right.
this is not one of these programs where you take a bunch of generic courses that are kind of, they could be anywhere. These are healthcare specific courses taught by experts at Johns Hopkins who are doing, I think, cutting edge research in these areas. So you have the application both with external partners, which I'll talk about in a minute, but also with our internal partners across the Hopkins ecosystem. So we have people doing patient safety, people doing quality, people were thinking about pharmaceutical strategy, people thinking about, what's going on with payers these days. So a variety of different industries, and so that breadth is really a strength, I think. Students are able to tailor their year to their interests. So if they're interested in more pharma strategy, that's something that they can pursue. If they're interested in hospital administration, that's something that they can pursue. And then the signature course is an experiential course that's 16 weeks. So normally our courses are 8 weeks, but this one is 16 weeks, in which we contract with external partners and we embed our students externally. And these are project-based courses where they're working with top pharmaceutical companies or, Johns Hopkins Hospital, or, Care First, or other types of big payers, right? And so these are supervised by faculty, but they are more working with the external partner. So they're gaining real experience in the field, in addition to this kind of business foundation training that we provide. So I would say that all of our courses have some experiential component to them, similar to what Mark described in his program. And then we have this signature piece where students are going externally. And so the curriculum, I think, is quite dynamic. It's quite fast paced. We're trying to get a lot in 1 year. But the 1 year option, I think, is very attractive to students in contrast to a 2 year degree. So that's what we're doing on the curriculum side, and students really express how it's the greatest strength of the program.
Now, Mark, I know at DeMoore McKim you have two concentrations in your curriculum. One is digital transformation, which you talked a fair bit about earlier, and then one is just healthcare administration. Give us a sense for the overall curriculum, the courses, and what
Yeah.
experiential learning students are able to get.
Yeah. Well, let me start with experiential learning. Experiential learning is basically it's the jobs they already have for most of them. And then they're applying different frameworks or methodologies from different courses to some aspect of their specific jobs or organizations to transform them. So the experiential is kind of built into who they are and what they're doing in the program. In terms
Mm,
of overall layout, I mean, it depends who you're talking to. If Gilbert was on with us right now, my co-director, he would talk about the basic business courses first, and we have them. Like we have half the teachers are from the Mayo Clinic, by the way, and then the others are DeMoore McKim, and we set that up for a reason. We wanted to have that diversity of interest, and everybody has a lot of applied work experience. So on the business side, our course in healthcare finance is taught by a current CFO in a really important company in the New England area, and he's a leading expert in value-based care systems structured by providers with payers that reward good outcomes. Very complex stuff. And the whole industry is shifting to value-based care. And not many people know it's tough how to really do that well. So that's what Patrick teaches. We have other courses in the curriculum on workforce strategy and metrics. The nursing shortage is such a big problem in the United States, at least, and how to deal with that. I had a student coming in who did a beautiful plan, John, that is now the strategy and methodology for HCA, 150 hospitals. He leads all that effort. his innovation project for my class was to come up with a next-gen methodology for dealing with nurse staffing, specifically skilled nurse staffing. So we have a set of what you would call the traditional courses. We have a tremendous teacher who's a neurosurgeon teaching the healthcare ethics class. He's just a delight to listen to. We should have him on this next time. Just a
Hmm.
wonderful man. Uh, and,
Hmm.
and other courses in information technology and database design. But then sort of like the icing on the cake or the pearls of the necklace, how we want to think about it, are a number of different courses focused on innovation. For example, my core course in innovation and enterprise growth that covers all the different aspects of product. We have medical device companies, drug companies in the program, people representing them, pharmaceutical companies, services innovation, both clinical and administrative in hospitals. That's one of the core courses. Another is then specifically services innovation and management. I have another great course by a guy who built a company, John, and just sold it last year. And every time I talk to him, he's driving around in a convertible in Florida, laughing and smoking a cigar. He has that halo effect. I don't know if I like him anymore. But anyhow, Craig teaches this great course on patient engagement informatics and analytics. And he has all the students do projects for their hospitals on how to improve patient retention, patient communications, how to measure all of this. Uh, I mean, I could go on. We have a wonderful course in data mining, in machine learning. I won't say for dummies, but you don't have to be an AI expert going into it to take the course. And that's taught by a male person who's just a tremendous communicator. So the way to think about this whole thing is we have core courses very much like what Michael described on the different aspects of the business of it. But then we have the icing on the case, which is to be an innovator, to be a thought leader, an innovator in your respect. Like, for example, maybe a third of the students are male staff. Mayo itself is the number one healthcare organization right now in the world, just not the US. They have like 80,000 employees now. It's almost a $20 billion a year organization. It's massive.
Oh.
And so when you have mid-career managers coming into those as students, for me, Mr. MIT guy, for my school, I'm humbled and I listen as much as I teach. And then they come in, then we've had students from John Hopkins University Hospital, Duke, all the different hospitals, the New York hospitals. We get these students together, and what the professors learn to do, I'm not a good example of it tonight, but they actually learn how to shut up and facilitate a conversation so that these highly experienced people say, oh, this is how we think about innovation. This is how we think about value-based care systems in our hospitals. This is how we're trying to deal with nursing shortage or patient intake, or the big problem is patient discharge in many of these big systems, because if you fix somebody and they come back within 30 days, the hospital has to pay for the readmission. And discharge is not handled well, either administratively inside of most large enterprises or when the patient goes back into their home. And IoT and all that stuff can really be applied usefully to improve that whole experience. So the bottom line is our courses, as I described, the experiential is the projects that they do in the courses. And we had the fact we have all have a lot of scars on their back. You know, the women as well as the men. And you would say half come from the business side, DeMoore McKim. I'm kind of a hybrid. And the other half are deeply in, they're from inside the Mayo Clinic. And that's how we try to bring things together.
Now, I think Michael and Mark have done a good job already in explaining how their MS and healthcare management differ from each other. I wonder if you might just spend a little time talking about how it differs from other programs at other institutions that we haven't even talked about, because as Michael noted earlier, there are a lot of these programs out there. I mean, to my mind, what really distinguishes these two is number one, at Northeastern, the partnership with the Mayo Clinic and its focus on digital transformation. And then at Johns Hopkins, the leverage of its great schools in medicine, nursing, and public health with the School of Business. But Michael, I wonder if you might ponder how your program differs from programs at other institutions?
Yeah, I mean, I think there are two things. One, I'll just reiterate that if you come to our program, you're coming to the number one university for health. I mean, there's just no way to see it any other way. We're the number one public health school. We're the number one nursing school. We have a world-renowned hospital. We're synonymous with health, and our business school focuses on the business of health. Um, I'll give you a few examples of what that really means. So every year I take the students on a tour of the hospital, and they work some at the hospital, and we learn about the intricacy and the complexity of a global hospital, of what it means to accept patients from all over the world. We tour the command center. We understand how they think about predictive modeling for, will this bed be free in the next 12 hours, And it's state of the art stuff, and it's really impressive. But then at Hopkins, we're also the original research university. And so what we have to offer across campus is really a unique set of institutes and centers where our students can go and learn about the cutting edge of that particular field. So we have the Armstrong Institute for Patient Safety and Quality, which is doing great work to reduce preventable harm. We have the Hopkins Business of Health Initiative, which is a platform on which hundreds of people interested in business of health across campus are doing interesting work. And associated with that is what we call a graduate academy. This is totally extracurricular, but students are able to get funding through this organization to go and work directly with Hopkins faculty on their projects. So there's a research component that is available to students that is, I think, unique in the world. Um, there's also, I run a conversation series where we bring leaders to campus. We've had CEOs of hospitals. We've had the president of Johns Hopkins Hospital. We've had people from pharma. We've had people from devices, Medtronic senior director recently that I interviewed. And what's great about that is that they're so willing to come to Hopkins, and then they are willing to stick around after these conversations and really network with our students. So the access that Hopkins generates is really, I think, extraordinary. We have two different centers at Carey that are thinking about AI adoption, and that are working on the AI, implementation of AI in healthcare settings. So I think the bottom line is that our big differentiating factor is just the Hopkins ecosystem. The second differentiating factor that I'll emphasize is we have a heavy presence in Washington, D.C. So there's a policy aspect that we all know interacts with healthcare management in important ways. The system is 55% publicly funded. So we think of the US as the Wild West for healthcare, but in fact, it's it's a majority public system. Um, and so our building in Washington, D.C. sits directly between the White House and the Capitol. And we host incredible events there. So recently we had Senator Whitehouse from Rhode Island, who came to talk about primary care and value-based care and the difficulties that Mark was talking about in implementing those things. And we had Secretary Becerra when he was the HHS secretary. And so, students are able to come to these events, and they have access to top leaders on the policy side that complements all of the management stuff that we're doing and the healthcare specific stuff that we're doing. So we have a lot of interaction with the agencies. We have a lot of interaction with members of Congress. And I think the combination of those two things really brings a great perspective that's unique across the country. There's not a lot of management programs that complement with this kind of access to Washington.
Yeah, it's true. I've been on the campus in Washington, D.C. It's spectacular, really. Now, and Michael, I have to say, I'm really impressed with how you answered the question because I was worried that because we went into so much detail on the curriculum and how the program is set up, that there wasn't much more to say, but you said plenty. So, Mark, I can guarantee you're going to say plenty about how your MS in healthcare management is set apart from programs at other institutions.
every MBA program has a healthcare track, or I would think they would, and there's some electives. Our program is all in. I should also say that in all the courses, we have a weekly live faculty connect on Zoom. Sometimes we have to scroll through like 3 screens to get all the students in, but we work them all in, and it's really the type of thing that brings the class together. Uh, what is the way this is distinguished and different is the focus is on innovation and the business case for innovation in many different dimensions. And the students are doing real work and bringing into their organizations, whether it's the Mayo Clinic or someplace else. I'll say one thing that's really interesting about this partnership with Mayo, it's really interesting, is that they have and talk about public policy. We have one course that focuses on the politics, one course. And it's taught by somebody who travels around the world, Gary Young, advising like the government of Egypt, what it should be doing, and the politicians in DC. And that's Gary's good at that. Um, the rest of us, we stick to our knitting, what we do best. Mine is innovation, others in marketing and so forth. But Mayo has a campus that originally for farmers in Rochester, Minnesota. John, have you ever been to Rochester?
Yes, I've done the executive exam, and I've got to tell you, it's the best healthcare experience I ever had in my life.
I've been there. I as both a faculty person and also as a patient. Boy, when you want to see customer centricity, the patient is number one. It's on the walls, but they really make all their decisions based on that. And then in every major unit, whether it's the clinical or the Mayo Labs, it's a $5 billion reference lab that's worldwide. It's an amazing business. Or if it's in other parts in education, the medical school, there's always an MD who's the top person, but then that person's right hand, co-equal of sorts, is an MBA. And so they always bring those two perspectives together. Then when the Mayo decided to expand, it was from Rochester, with its now 20 buildings, soon to be 25. Uh, and then they started a campus for the geriatric, well, I shouldn't say but the retired population in Arizona. So they have all that medical to learn from it and to apply down there. It's a mirror campus, another one in Jacksonville, Florida, to get the urban poor. And so now when we do our teaching, we draw from all these three diverse experiences, and you learn that, one size does not fit all. It's really quite interesting. And that gets all the way from the type of procedures that are done or the clinical diagnosis or the care down to basically patient compliance with medication and all the like. It really makes a difference. So we go all in and we explore it in different ways. I'll add one more thing to it that hasn't come in yet. It's not the majority of our students, but in a class of like, if you have a class with like 70, 80 students, there'll always be like 6 or 7 or more that are international. And the Zoom lets us do that. So I had one person who is, her name is Jewel from a remote part of the Philippines, who is the back surgeon for that part of the Philippines. And Jules, I had her in 2 of my courses. Her project for my last class was to develop a, uh, a, for the poor, a primary care center, a community health center that for the first time in that part of the Philippines actually has a digital electronic health record. And we all take that for granted. But for Jewel to like set aside her back surgeries and focus on that to help that community there is very special. I had another woman, Joey from China, who is introducing with an American partner the first AI assisted ECG technology for detecting, again, a certain type of arrhythmia for pediatric diagnosis of a certain type of heart condition that can kill or ruin a kid's life. And she's introducing that into China right now. So we have a cohort, they often international, that also tend to be entrepreneurial. And Michael, I'm a serial entrepreneur. I have written books on entrepreneurship, but we don't have an entrepreneurship course in this program, John. But I just can't help myself because when I see a mid-career professional wants to do a company, I'll say, forget about time. Let's take as much time as you need. Because if you have impact for what you're doing in a place where people need it, I'll give you all the time in the world. So that international aspect is enabled by the virtual delivery. So, you know, Michael's program is really focused all in, a different target population. Our focus is all in for that mid-career working professional where their jobs are their experiential learning. They're very different in focus, but they're both all in. I think all these MBAs just have a few electives. So people dabble in it, but they don't really do it. And I think that's the big difference.
Let's talk a little bit about outcomes. I'm wondering what kinds of roles or career paths have graduates pursued from your program, Michael?
Yeah, yeah. So, like I was saying that we're a broad program, and as a result, we have broad outcomes in terms of where people go. One of our best students this year ended up at Mayo, actually. So there's some connection with Mark, but the fellowship opportunities are there, and one of our students has taken one of those at Mayo. I would say about half of our students go to provider-based organizations, and a good example of that, we have someone who is the director of operations for the Sibley Hospital emergency room. Sibley's in one of the big hospitals in Washington, D.C. Her job is fascinating because in addition to managing a very busy ED, which we can imagine would be a complex task in itself. She works with the federal government for disaster preparedness. What does it look like if there's
Hmm.
an attack on Washington? How is that? How is the all of the levers of power that would be involved with something like that? How would they be working with the ED at one of the major hospitals? So her work is quite fascinating. She's a relatively recent graduate too. So about half of our students go to provider-based organizations like that, Mayo or Sibley Hospital or other kind of providers. The other half go to the kind of the broader healthcare industry. So this year we have someone who's going to AstraZeneca. We have someone who's going to consulting in Chicago. We have people who are going to Care First, which is the major insurer in our area. So a broad set of outcomes, but a very high quality set of outcomes.
Yeah.
We have people who are inspired by what's going on at Hopkins and choose to go on to get a PhD.
Mhm.
I think there are a lot of options. I think one of the things that we ask of students is to be very outgoing with the opportunities that we offer here. So we have a great curriculum, but as I was saying earlier, the differentiating factor here are all of the extracurriculars that we offer, the possibilities, the different kind of connections that can be made. And so we really ask students to just be very forthcoming with their interests and outgoing, and those usually lead to some wonderful connections for their careers. One other example that I'll give you is that we have developed a nice partnership with Johns Hopkins International Solutions. This is an organization within Hopkins that, because so much innovative research is going on, there's so many products that are being developed at Hopkins. And these products can then be marketed to the world. So a lot of our students actually, some of our students, I should say, have been embedded in this group, and they think about every stage of the development process of a product and how it then goes to market, which I think is a nice kind of encapsulation of the broad set of things outside of just providers that students can go and do with our degree. The marketing, the finance, the entrepreneurial finance, the testing, the quantitative data that's required. So like demonstrating ROI to these potential clients. And then, like Mark said, we have about our percentage is a little bit higher. I would say about 50% of our students are international. And many of them go and take immediate leading positions in their respective ministries of health or large kind of organizations, healthcare organizations in their home countries. So I was in the Middle East in January, talking with potential partners there. They're all very interested in working with our program. So when you come to our program, what you're getting is a global perspective, and the outcomes reflect that.
Right. Mark, what about career outcomes in your program? Obviously, people who attend online and part-time already have jobs. I'm assuming some will use the degree to transition to new roles, and some
Yeah.
simply to enhance their current career and maybe accelerate it, right?
Yeah, everybody is an individual case, but they're not looking to get in. So we have some looking to get into the industry, but they're rare. Most are already in the industry and they're looking to accelerate their careers. I mean, I tend to look at it almost functionally. We have people who are MDs, believe it or not, and they do things like create new clinics, like an aging clinic at a major university hospital. Or another person has created a very interesting, I don't know if you guys have been following it, but all the advances in metabolic health. I mean, they're literally linking the microbiome to mitochondria inside the cell, and that links to cell health and maybe specific diseases like psychosis or fatty liver disease. Uh,
Mm,
so we have MDs doing research who do their projects that combine the clinical science with the IT sides of it to design new clinical services. We also have people working in this area of digital pathology, very global, about applying vision AI to help make that process better and much, much more efficient. I mean, Fred Smith just passed away, who is the founder of FedEx. And I can tell you the big reference labs like the Mayo, they've been spending a lot of money on FedEx and UPS and all the others, shipping these slides literally around the world, and the time needed to do all that. And so if a lot of that goes digital with AI, that is just not different. That's disruptive. Uh, the whole thing about clinical research and patient recruitment and patient retention, that's a whole nother career path for people. It all depends where they are and where they want to advance. We have some amazing nurse managers in the program. And
mm,
I love the nurses because they're so much more practical than anybody else on the planet. And they come on in and they're managing intense operations. And so their projects are all process optimization efficiency. It's just patient flow, get them in, OR, turnover really fast. And so these people advance in their different areas of expertise. We've had in the last couple of years, uh, a trend of people engaged in home health care. I had a student, one of my best students, last semester in a healthcare IT course, works for one of the largest home healthcare providers in the country, and it's called Bayada Health. They have so much business, they got to turn a lot of it away. There's
hmm,
so many people seeking home health care. So he worked
yeah,
on the whole process of onboarding a new patient, which is very hands-on and very messy, and using agentic AI to streamline all that. The other thing that they have to do is they can't have nurses running all over the place. They need to use AI and robotics to basically monitor and send alerts from patients in their home. Uh, and so those are the types of things that people are doing. One of the things that's been happening in the program is that uh, now all the professors want to keep once a student, always a student, and it just sort of happens that now we have regular TAs as any university has, then we have teaching fellows or super TAs. And these people are some of our best students. They have their busy jobs, but they make the time to basically help with monitoring and coaching the project work going on in the program. So we now have an alumni group around the program of these really wonderful former students who know every bit as much as the professors. They just don't have all the frameworks, coming into it, but now they know them, and they're now part of the entire teaching team. So the outcomes, to answer your question in a briefer way, they already all have jobs. They're really not looking to join a different organization, but they want to accelerate inside of what tend to be very large healthcare organizations. We have a woman who has just been promoted at the University of Utah, who's focused on diabetes in Hispanic and specifically Mexican immigrants to the United States, who have clinical obesity twice as high as white Caucasian women in the United States. And so, how do you set up a telehealth center? That's her project. A telehealth center that can provide constant feedback and monitoring these people, and have a support groups around that so these women can take better care of themselves and stay out of the hospital.
right.
That's
Yeah.
the program, is the diversity of the outcomes. It's really career acceleration through their experiential work in the program.
So, Michael, let me ask you this. I know we're all aware that there's a lot of pressure on the healthcare system in the US, if not the world. If you were to identify what you would consider to be the most pressing challenges in healthcare today, and then maybe even connect them to how your program is helping prepare graduates to deal with those challenges, we'd love to hear that.
Yeah, sure. Yeah. I mean, this is, it's a laundry list, right? There's a long list of things that I think leaders in healthcare have to concern themselves with. Yeah, I would highlight a few. One is something we've already talked about, which is the implementation of value-based care. We've kind of theoretically known that it's what we need to do for so long. And yet the practical implication for a private practice to implement value-based care is extremely challenging and to keep everybody on board. So there's a real organizational management kind of component to this to keep everybody on board, to make sure that there's a kind of a central vision. Why are we doing this, and how is this, and how can we make sure that that everything is incentive compatible, so that all the physicians are working towards promoting health in the organization. I think that's one. We had recently Senator Whitehouse talking about on a panel of esteemed experts from Harvard, from Washington, from a couple of people from Washington, some startups thinking about the implementation of value-based care, and it was just really illuminating, and it was really helpful to see the policy angles, what they're talking about in the Senate, while in addition to um, what they're talking about in organizations. Another one is just the adoption of digital health, the adoption of AI tools, the adoption of any kind of new technologies in these in healthcare, in the provision of healthcare. And I say that it's a challenge because in addition to uncertainty about where that industry is going, there's uncertainty about which product to go with. I mean, we talk about AI as kind of this kind of singular thing, but there are like hundreds of different digital health providers, right? And so it's a two-step process. You have to identify that want to make you want to adopt something, and then which one, and so that requires quite a bit of quantitative sophistication. I need to kind of project the ROI or think about the ROI of different types of products. um, and the last one that I'll that and at Hopkins we have two centers that are thinking about the adoption and implementation of AI uh, at the Carey Business School, and they teach our classes, and they're really extraordinary experts. And so they are bringing that expertise to these problems, and I think our students come out with skills that are immediately very applicable to those questions. And the last one that I'll just bring up is just labor markets. So the market for nurse labor, the market for physician labor. And again, I'll come back to the policy angle here because just thinking about the supply of healthcare. Thinking about markets as two-sided, right? We talk so much about insurance provision, we talk so much about getting people into preventive care, but there have to be physicians and nurses to provide that care, right? And so how we can train and retain physicians and nurses, keeping them engaged, keeping them from burning out, keeping them happy, making them as effective as they can possibly be, and reducing the burdens on them that every physician tells you, right? Every single survey says, if I didn't have to do 20 hours of paperwork every week, I could do a lot more in the clinic. I could do a lot more for my patients. And so, balancing those things, trying to have an organization that's efficient, an organization that promotes care, but also checks all the boxes from a regulatory perspective, is really challenging. So, thinking about the labor markets, and in this case, our partnership with the School of Nursing, I think, is really important. So, we have the number one nursing school in the country at Johns Hopkins, and their expertise, a number of their faculty give guest lectures in our courses. So, understanding that perspective of the labor markets, I think is something that you might not get elsewhere.
Mark, your take on the most pressing problems facing the
I
industry.
feel, I feel bad that I mentioned that Mayo was the #1 hospital in the world, because now there's a lot of #1s being thrown. I mean, Mayo is a very humble, wonderful place. That's why when people go there as residents, they never leave. All my friends out there have just been lifers. It's a very modest place, but I think it does bring up a point. There's a lot of innovation happening on the periphery. Rochester, Minnesota ain't Boston. It ain't DC. It ain't the traditional hub. And sometimes when people just left the focus and leave all the noise, they can really focus on task. And sometimes it comes out better. And that's what I've learned by being involved with the Mayo Clinic. And it's quite interesting to think about innovation outside the periphery. Now, we have partners in this that are around the globe. I mean, for example, just through the Mayo Clinic, they have 150 medical partners around the world who are major hospital systems like Seoul National University Hospital in Korea, just as an example. And they're all collaborating basically on one thing, which is the power of data to improve clinical care. So there's a tremendous opportunity for anybody who's listening. You know, forget all the politics and all that stuff. Your hospitals are basically learning on Epic. They're running on Epic. Epic is loaded with millions and millions of records of data in all your different healthcare providers. Epic has now created a relational database that can dump all that data out into something they can use for analytics and for research called Clarity. And on top of another thing called Slicer and Dicer. They're not a commercial for Epic, but they're done the right thing. And so now you have all this data at your disposal if you're innovating, that you can then aim the lens at something very specific to see if you can find a pattern and incidence and create a model out of it, test the heck out of it, because these systems do hallucinate sometimes. And then based on thorough testing, you can actually make an impact on patient care. Same thing in terms of administrative data. These enterprises have so much data administratively, they just never tapped it or mined it. Now, we have courses, our courses help people learn the basic frameworks for tapping the data and applying it based on domain specific frameworks that are not so technical, they're common sense, but help them apply it to like workforce planning. And then their projects are to grab some data from their hospitals and apply it and see what comes out and see if there's something that can be sustained from that. So I think that in terms of those problems, now you asked what are the problems in healthcare, continuum of care, John. We send all these patients out of the hospital and we hope they're okay. And there's nothing really systematic to make sure that they are okay. But yet I was talking with somebody, for example, doesn't exist yet, but probably everybody listening has an Apple Watch or Samsung Galaxy, depending on where they're living, Asia over in the United States, right? And so with that watch now we call Apple Health, but it really has not yet been transformed into Apple Care Gen 2, which is Apple Care for your health. And how could somebody wearing a watch once they leave a hospital be connected and take pictures with their phones of what they're eating and have a holistic picture and have that linked to a large language model that's clinically backed with research that shows when you get out of the hospital, if you do this and you do that and you're sleeping so much and you take those steps we should all be taking, John, every day, that basically your outcomes will be much better than if you don't, if you have a certain type of disease and you have of a certain age. So for all of you listening, I mean, the transformation that's going to happen in healthcare is just, it's already quite remarkable. It's going to double up every 2 or 3 years. It's just going to take a leap. And I'm not so sure that all of it's going to be happening in the traditional, centers of medicine in established markets. Because in this program already, I've seen so much wonderful stuff being done on the periphery. And often that's where the real innovation happens. There's less inertia in such environments. I actually, in prep for this, I have a friend who's the dean of Mayo Medical School. He's actually a fishing buddy. I called him, Fred, some guy's going to ask me a question about the challenges in healthcare, but we're teaching a program to deal with them. And Fred just goes, let's go fishing next month. There's a lot of challenges. I mean, they're worried about, are their endowments going to
Indeed.
be, what's going to happen, Mike, if they start taxing the endowments on your university? What's going to happen? What's going to happen if half your research funding gets cut? That's politics. What's going to happen if it becomes more difficult to recruit international students? There's all sorts of issues that are inherently political. But then there's more tactical issues, such as the manpower planning, such as the safe development and use of AI for specific clinical care. There's very tactical issues. And in our program, John, we focus on more the tactical stuff, and we leave the politics for others to hopefully someday figure out.
Thankfully. So, gentlemen, we've run out of time, but if someone is interested in your programs, tell us what their next steps should be. Both these schools have great websites. You can see the full curriculum, core courses, your elective choices, how long it will take, what it will cost, the availability of scholarship and other tuition discounts. So that's a great place to go right off the bat. But Michael, is there anyone they can get in touch with that you would recommend?
Well, I'll go out on a limb and say that you may email me directly.
There you go.
But and that would I would be happy to have a conversation with anybody interested in the program. A couple things. One is just make an appointment with our admissions team, and they will help you with that process. Another is that we actually host on our website opportunities for students to join our events. So in my Conversations for Healthcare Management series, we often have 10 or 15 prospective students on Zoom who are zooming into the conversation. So if you want to get a flavor of what we're doing, please join us for one of our events. I think that's a great way to see what it's like here. But for direct questions about admissions, on the website, we have a team that can help you with all your questions.
And Michael, what's your email address?
It is mdarden4@jhu.edu.
There you go. Mark, who should someone reach out to if they're interested in the Northeastern program with the Mayo Clinic?
Well, if you're a fisherman, you can just call me up directly. I'll give you my cell phone. But otherwise, uh, we have a really efficient receiver called, it's just online at northeastern.edu. Email them and say interested in the digital healthcare transformation program, and then they'll direct you to one of us on the team to answer your questions. I would ask all the people listening for interesting, just now be one of our students tomorrow and just say to yourself going in to work tomorrow, what are the problems that you'd like to solve in your job that you see around you? Be a design thinker a little bit. And if something really like grabs your interest, come into the program. And that's the motivation that I would ask you to have. Just don't come in for a bunch of courses. Come in to solve a problem that can be beneficial to your organization, your patients, your career. And then that's the holy grail right there. That's the
Great
motivation.
advice.
Yeah.
Well,
Thank
Michael
you
and
for
Mark,
this.
thank you so much. I think we really learned a lot about the programs, what issues they address, how you equip people to solve those, or at least attempt to solve those problems. And again, we've been speaking with Michael Darden, who is the academic program director of the MS Healthcare Management Program at the Carey School of Business at Johns Hopkins University, and Mark Meyer, who is the co-director and a professor of entrepreneurship at Northeastern University's DeMoore McKim School of Business, and like I mentioned, co-director of the MS in Healthcare Management Program. Thank you both. And for all of you out there, thanks for watching.